brings me to the mega slide. And this is how I'm trying to envision integrative Ayurveda for cancer. There are 2 or 3 nodes which are important. The first node is the diagnosis of cancer. When someone is just recently diagnosed with cancer, what occurs? What can they do? And there are different elements that they need to address. Whatever are the blue colored boxes, they are the ones that Ayurveda has a role for. The deeper the blue, the deeper the hue, the stronger the role of Ayurveda in it. The other node after diagnosis of cancer is life as a cancer survivor. And we're going to see many millions of them in the next 5 to 10 years. And thankfully, we have survivorship. Cancer survivorship is a great phenomenon because it tells us that people are surviving and they are living after cancer also. So there has been a lot of progress that has been made in the management of cancer, which tells us that it is not really an end game diagnosis. Okay. So the first thing that we do once someone has a diagnosis of cancer is to understand the prognosis of the disease, what form of cancer it is, how bad is it, how does it typically respond to treatment, and whether you belong to that typical group or to the atypical group. So that's the first thing that we do. Understanding conventional assessments and the treatment, what are going to be the markers for it, what are going to be the regular treatment suggestions for it, what are then going to be the expected complications and side effects, which are also just as dreadful as the disease. However, many of them are reversible and are transient, and they just need to be endured. For most people who do not seek Ayurveda, they just endure those adverse effects. From an Ayurveda landscape, there is a management of adverse effects of mainstream treatments. There's a big role of Ayurveda for that. And for all of these blocks, I'm going to explain all, the options in more detail. And that's what the presentation is going to be about. Second, there are also some medicinal plants with known anti-cancer activity, which can be considered either at this stage or at a later stage in the cancer survivorship mode. Third is the understanding of the evolving interdiscipline of integrative oncology, where a lot of people a lot of mainstream institutions are trying to add on mindfulness and yoga and emotional, spiritual support groups that they're trying to do trying to put together for patients. What is the role of Ayurveda there? Where does it come there? And what is not being covered from Ayurveda in those centers is also something that we will talk about. Fourth, Ayurvedic path of health restoration, and this is a very unique process. This path of health restoration is called, there's a technical word for it, and it's called salutogenesis. Ayurvedic salutogenesis is more management focused at this stage. And there are huge benefits of helping to steadily experience this transition, this life transition that occurs with the diagnosis of cancer. The last one is palliative care for those tricky cancers which are aggressive enough to take people towards more morbid conditions very rapidly. Ayurveda has some role there too. Once there is a stabilization of cancer and that it's out of the system and the cells are out of the system, life as a cancer survivor, also there is a role of Ayurvedic path of health restoration, which is now prevention focused. And rehabilitative care, uh, especially for conditions where certain tissues, vulnerable tissues have been affected. What kind of rasayanas and what kind of therapies can we instate for people? There are considerations for that. And C is secondary prevention, and that is removal of causes. And understanding those causes is important also for primary prevention, so that we do not get the cancer in the first place. So what is the things that we can do in our life and environment to not, which are easily modifiable causes?